actually did a study of our employees, and we had them volunteer, and we stratified their stress levels by heart rate variability and cortisol levels into quintiles. And we found that our employees that were in the highest quintile of stress had $2,500 more a year of healthcare costs. We put them through mindfulness and yoga training for 12 weeks, and we saw costs drop like a rock in the post-testing. So we know this stuff works. And when I first introduced it, I said, oh God, the chairman does yoga, so we all got to do yoga now. And we've had now 6,000 employees go through this training. In our company, we now offer it to all of our clients. We do it for free. And so we believe in this. It's just building the evidence base. We've got to start somewhere, and we've got to pioneer somewhere. And I think if we get people asking for it, and if you look at the spend out of pocket that people are doing on yoga, on craniosacral therapy, on massage therapy, it's a lot of money. And I think people want it, and they find it valuable. That's how I manage it. I go to a naturopath. I've had my blood test on food sensitivities. I've lost 48 pounds just by having my blood tested. Now, my allopathic doctors would say, that's all crazy, you're just watching your diet as a result of getting some blood work back. No, I'm not eating eggs, I'm not eating milk, I'm not taking in any dairy, and I lost 48 pounds. And I look at my doctor and say, you're 30 pounds overweight. How's that working for you? How's your nutritional therapy working for you as an allopath? So I think we've got to challenge the norm by introducing programs and getting people to try it. I actually gave a speech at the New York State Naturopathic Association meeting. And it was, people freaked out because you got, a health insurance CEO standing up front of a bunch of naturopaths saying, I love you guys. And I think we've just got to keep pushing that agenda. The Aetna Foundation gives away about $20 million a year. One of our programs is around the food supply. And so we support Wholesome Wave, which for every person that goes using food stamps to a store and buys healthy food, we give them a voucher to a local farmer's market to double up on that food. Of the people we cover, 34% of them are obese. They drive over 60% of our healthcare costs. And so obesity is the biggest epidemic this country has ever seen. The world is now seeing it. We've exported our poison around the world. And now we have this horrible onset of diabetes that's going to overwhelm our ability to take care of people. There are 114 million diabetics in China already. 22 million in the United States. And so we've got to get in front of this issue. And the food supply is a key part of it. We've got a PDA for all these drugs, right? Physician desk reference, PDR. We've got a PDR in Europe for supplements, but we don't have a PDR for food. And we consume more of that than we consume of supplements and of drugs. So I think it's as big an issue.